So there are several unmet needs. T-cell lymphoma, and I have to say this on record, it's been the poor cousin of B-cell lymphomas. So there are not many therapeutics. There are only 6 approved therapies. And in the frontline therapy, while we talked about Echelon 2, very effective in CD30 positive lymphomas. Once they do relapse, even in the CD30 positive and in the CD30 negatives, the story is not as good. And I think we are a huge unmet need, and patients struggle a lot. And clinical studies are the first option for these patients. And some of these patients who relapse end up having a median survival of less than 15 months. So it's a huge unmet need, and this is for nodal lymphomas. For some of the cutaneous T-cell lymphomas, especially this advanced stages, the stage 2Bs and the 3s and 4s, when they do relapse, even though mycosis fungoides or CTCL overall has a good prognosis, these advanced stage disease patients relapse pretty quickly, and the responses are short-lived. Except maybe for a few patients who have CD30 positive and they can get brentuximab, or Sézary syndrome and they can get mogamulizumab. But for the transformed MF patients or the patients who fail mogamulizumab, we don't really have a whole lot of therapies. So if 6 therapeutics for a disease that's very hard to treat, and think of cutaneous T-cell lymphomas, these are patients with skin lesions which are oozing, frequent infections, they need constant wound care, and the performance status can be very poor from the disease. And obviously when you treat the disease, the performance status improves. So there's a huge unmet need, and that's the reason why we're doing clinical studies such as the COBALT-LYM study.